Um, Welcome to the Reischauer Center for East Asian Studies here at Johns Hopkins University. I'm Kent Calder, the director of the center, and we're delighted to have you all with us. We have an extremely interesting program today that flows on a tremendously important international topic on which the Reischauer Center also has issued a major new report. The subject, Shadows of COVID-19, the Developing World and East Asia's Response. As our participants today, we have two distinguished specialists on international development. First, Keiichiro Nakazawa, who is currently the Senior Vice President of JICA, the Japan International Cooperation Agency that handles Japan's international development assistance. And then as our second distinguished participant, we have Ambassador Cinnamon Dornsife, who's currently senior advisor to the International Development Program here at SAIS, Johns Hopkins University, and also served previously as American ambassador to the Asian Development Bank. The subject it relates, as I say, to the recent report which we've done. We talk a lot, of course, about the course of COVID-19. It's a subject that is omnipresent around us. In China, in Europe, in the US, of course, we have all battled with the pandemic. Those areas were the heart of the COVID-19 challenge for the first half of this past year. COVID-19 in the US, of course, gets tremendous attention and can't be depreciated as an issue, with the United States having 4% of world population and over 20% of infections, almost 6 million and almost 180,000 deaths. There is, however, and that's the subject that we would like to address today, another terribly serious global challenge arising in developing countries outside of East Asia, which could become the most serious aspect of the entire crisis in human terms, only a few short weeks or months from now. And that is the crisis of COVID in the developing world outside East Asia, particularly in South Asia, Africa, and Latin America. India, for example, has had the highest number of new infections globally for most of the past week and more. India, together with Brazil and South Africa, rank among the top 5 nations in the world in new infections, a list that's still headed, of course, by the United States, but where the share of the developing world is rising steadily. In April, only 2 developing nations, China and Iran, were on the list of the top 10. This past week, 6 of the top 10, with the largest number of infections, have been in the developing world. At the Reischauer Center, we've been concerned and have worked since this last March on the question of COVID and its global implications. We did a report on lessons from East Asia for the world. We did another last month on East Asia's role in the world after COVID. And then this current report is the third in that series. And the report itself, of course, will discuss details of that and then the underlying issues today. It is going to be available on our website, and talks about issues like overburdened healthcare systems, medical infrastructure, medical supply access, the importance of access to online services, digital approaches to monitoring the pandemic. And then, of course, major economic implications like the deepening inequality, the health versus economy trade-offs, the problems of refugees and migrants, and the deepening of international debt, which is occurring because of the crisis across the developing world. Of course, there are rays of hope as well. We'll hear about some of the success stories in Rwanda, in Mongolia, in Vietnam, among others. But then in the end, one crucial point that we come back to is the role of East Asia itself, its potential, and in terms of sharing experience, but particularly in assistance, not only from China, which we hear about a lot, but also and increasingly from Japan. And as I mentioned, we have as our first presenter today, Keiichiro Nakazawa, with long experience across the developing world, in Myanmar, with South Asia, also responsible for the Middle East and North Africa today, but with his degree from the Kennedy School at Harvard University, so a distinguished career and important insights. And Keiichiro, we look forward to hearing from you.
So thank you. So it's my great pleasure to be back at SAIS today, although it's virtual. Now, I thank first Professor Calder and SAIS for inviting me to this timely discussion. When I was last invited to speak at SAIS event, I think 3 years ago, I spoke about the Bay of Bengal. At that time, I emphasized the importance of regional connectivity among the nations surrounding the Bay of Bengal, as well as the importance of their connectivity with ASEAN in the context of a free and open Indo-Pacific. That is still very much true, even though globalization and connectivity sometimes pose difficult challenges, as COVID-19 underscores. So today, I will talk about what has happened in India as I see it, and I will then highlight some examples of JICA's health sector cooperation in other countries and conclude with more remarks about our work in India. So, but before going further, please allow me to issue a disclaimer that the views and opinions I express today are solely mine and do not necessarily reflect the official position or policy of JICA or the Japanese government. I was shocked by the statement World Bank President David Malpass made last week to the effect that COVID-19 may have already driven as many as 100 million people back into extreme poverty. You might remember that during the 15-year period when the international community tried to achieve the Millennium Development Goals, we witnessed significant progress in poverty reduction, particularly in Asia. China and some other Southeast Asian countries even took the lead here, but what did not receive as much attention then was that between 2011 and 2015, for the last 5 years of MDG's period, the extreme poverty ratio in India declined dramatically from 21.6% to 13.4%. More than 90 million Indians escaped from extreme poverty during this period. What a remarkable achievement, I should say. However, 176 million Indians were still living in extreme poverty, and 659 million more, or half the country's population, still fell below the higher poverty line of $3.2 a day. Those are the vulnerable people who have been affected most by COVID-19. The first cases of COVID-19 in India were reported in Kerala between January 30 and February 3rd. The trajectory of the outbreak remained flat over the next month. In the first week of March, there was an upward curve on account of new emerging hotspots. Prime Minister Modi took very quick action in response. He delivered a nationally televised speech at 8 p.m. local time on Monday, 24th, during which he announced a national lockdown that was slated to take effect the next day, 4 hours after the announcement. By that time, India has 536 COVID-19 cases and 10 deaths from the disease. In comparison, the UK locked down 2 days prior to India, when that country had more than 6,000 COVID-19 cases and 331 deaths from the disease. So even without taking into account the big difference in population size between the two countries, we can say India acted very swiftly. At the same time, the Prime Minister announced the lockdown. The Indian government unveiled the India COVID-19 Emergency Response and Health System Prepared Package. Under this package, 150 billion rupee or $2 billion was earmarked for treating patients with the coronavirus and strengthening the country's medical infrastructure. The World Bank, ADB, and AIIB subsequently extended financing for the package. Then, one day after the lockdown started, Indian Finance Minister announced the provision of cash and 5 kg of rice or wheat to the poor as a safety net. I really appreciate the Indian government's decision to implement the lockdown early on, because by at least delaying a surge in cases and raising people's awareness of the coronavirus, it could buy some time for hospitals and healthcare centers to prepare for testing and treating patients. I believe this action made possible the more than 800,000 tests which are now conducted daily in the country, and India's sense of caution regarding COVID-19 has held to this day. Unfortunately, however, the hasty lockdown put many urban informal workers or gig workers out on the street. Many of them were migrants who are originally from rural areas of India. They lost their jobs and housing because of the lockdown, and there was no public transportation available to return them to their hometowns. Some of them even had to make that journey by foot, walking hundreds of miles. In fact, it was only after 4 months of the lockdown that the Modi government approved people's movement to their hometowns and resumed some train operations. Such chaotic movement is said to be one of the causes of the spread of the coronavirus from urban to rural area of India. After extending the lockdown 3 times, the Indian government finally determined to gradually lift it in May for the sake of economy. But even the lockdown could not halt the virus spread as much as the government would have wanted. The total number of COVID-19 cases in India exceeded those in China by mid-May, and even before the Indian national lockdown was gradually lifted, the number of cases in India was double the number of China's cases, unfortunately. The increase in cases has further accelerated since June, reaching 3 million, which trails only the US and Brazil. Very unfortunately, again, I cannot say with confidence yet that the infection is under control now. But it is noteworthy that even under such severe domestic circumstances, the Indian government has pursued active diplomacy and is extending international cooperation to other developing countries that are themselves struggling to cope with COVID-19 pandemic. As an illustration of this active diplomacy, Prime Minister Modi, acting upon his neighborhood first principle, led a summit of the South Asian Association for Regional Cooperation, or SAARC, on March 16, during which he gained consensus for establishing the COVID-19 Emergency Fund. In addition, India has provided many countries with hydroxychloroquine, a malaria medicine that has been promoted as a treatment for COVID-19. So now let me turn to what we JICA have done in the health sector to help our partner countries prepare for infectious disease outbreak like the one the world is experiencing now. JICA has a long history of assisting our partner countries' efforts to develop human resources and supporting health sector organizations and institutions. This is because we put high importance on our partners' capacity enhancement so that they can eventually respond to health crises and challenges by themselves. For example, in Vietnam, JICA has provided numerous technical cooperation programs, one of which incorporates technical guidance on nosocomial or in-hospital infection control. When severe acute respiratory syndromes or SARS hit Vietnam in 2003, Bach Mai Hospital in Hanoi, a beneficiary of this technical cooperation program, contributed greatly in bringing it under control. We are sure that such viable experiences, complemented and compounded by the continuous efforts of the Vietnamese, have played a role in the country's success to date against COVID-19. Another fitting example of our health assistance is in Ghana. In 1979, the Noguchi Memorial Institute for Medical Research was established in Accra with grant funding from the Japanese government. It's named after Hideo Noguchi, who devoted himself to researching yellow fever in Ghana in the 1920s. And about 50 of its researchers have participated in JICA's capacity development training programs. Some of them have received their PhDs in Japan. The Noguchi Memorial Institute alone is responsible for about 80% of the PCR tests conducted in Ghana since the outbreak of COVID-19 there. Mm. And its highly trained personnel have provided advice to counterparts from 9 neighboring countries of Ghana. So more recently, JICA President Kitaoka launched a global initiative to promote health and medicine. Under this new flagship initiative, JICA will focus on the following 4 areas of health sector cooperation. 1, infectious disease research, diagnosis, and early warning systems. 2, infectious disease treatment and case management systems. 3, infectious disease prevention and mainstreaming of health security across all sectors. And number 4, resilient universal health coverage founded on primary healthcare. So as we try to address COVID-19, it must be recognized that we have to overcome 2 formidable challenges that COVID-19 embodies. One, as I have implied, is medical, but the other is economic. In India, JICA is working with the Indian government to address both of these challenges. Case in point, JICA is consulting with the government to provide $500 million of concessional budget support loan to support the Indian Prime Minister's initiative for self-reliant and healthy India. The key outcomes of these programs are strengthening public health infrastructure for pandemic preparedness, strengthening surveillance of infectious disease and outbreak response, and strengthening digital health services, among others. Moreover, JICA is planning to formulate another project in a less fortunate part of India, the Northeast, where health access and quality are among the lowest in the country. This project aims to improve people's access to better medical services by enhancing medical coverage and top referral hospitals, which could serve as core medical hubs in the region. So let me stop there. Thank you.
Thank you very much, Keiichiro. You have, I know one subject that's in the, well, we have a lot of subjects in the background, but this whole question of hospitals and medical infrastructure and the potential role that Japan can play, I know after Cinnamon's presentation and in our discussion, we look forward to hearing from you on issues like that. It gives me a great deal of pleasure to introduce Ambassador Cinnamon Dornsife. I think I already mentioned that she was our U.S. ambassador to the Asian Development Bank. She heads what's becoming very important here at SAIS, the work relating to social entrepreneurship leadership activities. She's spent time, 10 years or so, with the Asia Foundation. She has done field work in Indonesia and has very, very broad experience relating to issues of development. And in particular, in that, Cinnamon, you worked with the Asian Development Bank. I wondered if you could say something about the international financial institutions and their role in combating COVID-19 in the developing world.
Thank you, Dr. Calder, for that lovely introduction. Thank you, Nakazawa-san, for your very interesting remarks. And tonight, here in DC, it's nighttime, of course. Welcome to all of you who are joining us from around the world. It's a pleasure to be here. I'd like to congratulate you on your very interesting reports that you have issued in the past, and indeed the new one that is just being issued this evening. I will be pleased to talk about the international financial institutions, but I'd like to place that in the context of the global pandemic and the financial impact that has been felt around the world, and in particular the impacts on international development and what leading international financial institutions have done to respond to this global pandemic, this unprecedented crisis. So in total, Bloomberg estimated that as of June, $11.5 trillion has already been earmarked for COVID-19 stimulus packages globally, yet trillions more will be needed to be spent over the course of a long recovery. The long recovery really caught my attention. And so therefore, you need existing institutions with very solid track records and very good products and services for their clients, member governments, the international financial institutions, to support the response to this pandemic. The global economy is projected to contract at least 5 to 6% this year. And by the end of 2020, Dr. Calder, you referred to this as well, the global sovereign debt is going to be greater as a percentage of GDP than at the end of World War II. All of this is so amazingly sobering. Nakazawa-san, you mentioned that an estimated 70 to 100 million people could be pushed into extreme poverty this year, eradicating decades of progress. And 130 million people could be pushed to the brink of starvation by the end of 2020. The IFIs provided critical emergency financing for COVID-19 responses to over 100 countries. And this large-scale financing could help countries build back better, in addition to addressing their immediate and most pressing needs. So if we take a look at a database that's put together by our colleagues across Massachusetts Avenue here at the Center for Strategic and International Studies in Washington, D.C., there is a tracker of IFI assistance related to the COVID-19 crisis. And they provide data indicating that $175 billion has been provided to date. About half of that has been allocated by the IMF, and the other half has been allocated by the multilateral development banks. Another interesting point that I'd like to raise here, because I think this is a way that the report that you issued, Dr. Calder, you and your staff and colleagues, could be strengthened, would be to add a reference to sustainable development. And I know that the pressing needs, especially the health needs and the economic needs, are so urgent, but a couple of policy statements from the IMF, from the African Development Bank, from the Asian Development Bank, and others, President Malpass at the World Bank, really emphasized the importance of sustainable development. And another statistic that really struck me was that more than 60% of the population around the world, including more than 80% in China, India, and Mexico, indicate that climate change should be addressed in the context of fighting this pandemic. That was really striking to me. So I mentioned the CSIS database. I commend that to all of you. That gives a lot of detail in terms of all of the lending, technical assistance, grants, and policy priorities established by those institutions. It also points out regionally that the largest recipient of assistance from the international financial institutions is the Americas. And in part, that is because of the flexible credit lines that were issued by the IMF to Colombia, Chile, and Peru. But the second and third largest areas in terms of recipients of aid are Africa, about 37.9 billion, and Asia, Oceania, at 33.0 billion. And again, all those statistics come from the CSIS database. Now, turning to the World Bank, this comes from the World Bank's website. So that's if people need to verify these statistics or if they're interested in following up, this is where you would find that information. So the World Bank Group has promised to allocate up to 160 billion in tailored financing to address the health, economic, and social shocks that countries are facing. Of that 160 billion, 50 billion is being provided in IDA resources. IDA is International Development Association, and those are for the poorest countries in the world. This is an income indicator measure for gross national income of $1,185 and below, and there are 74 IDA eligible countries in the world. So far, the World Bank has provided assistance to more than 100 of its member governments. And so they have been stepping up to be responsive. In addition to the financing, they provide technical assistance. And Nakazawa-san, you mentioned this as well, that this is one of the things that JICA takes pride in providing along with its financial assistance and policy advice. And so they are helping also to address the health and economic impacts, maintaining the country's private sectors. And this gets into some of the recommendations that I would like to share with you in a few minutes. But first of all, I want to summarize the roles of these leading institutions. And President Malpass said, we've been focusing on countries to reinforce healthcare systems, protect the poorest households, maintain economic foundations, fight inequality, and ensure resilient and sustainable recovery. And that kind of harkens back to the point that I'd made about the importance of sustainable development, and indeed how many citizens around the world regard that as such a high priority. I mentioned the CSIS database in that they indicated that the largest provider of assistance from the MDB community is the EBRD, the European Bank for Reconstruction and Development, but the second largest is my former institution, the Asian Development Bank. And I would like to give a nod here of appreciation and thanks to the Japanese government for their leadership role in the Asian Development Bank. Indeed, they were one of the co-founders. It was initiated by the government of Japan, but they very wisely recognized the value of multilateralism and approached many other governments, including the United States. So the US and Japan are co-equal shareholders, but about 40% of the cash, by my accounting, is provided by the Japanese government. And also the Asian Development Bank Institute, where I served on their advisory council for 10 years, is based in Tokyo. And the vast majority of the financing for that institute that provides some really good ideas, including, for example, what more can be done to attract wary investors to invest in Asian infrastructure. Very important topic. That's just one of the many policy relevant research papers that is provided by the ADB. Mm-hmm. They were an early provider of assistance. The World Bank has pledged 160 billion. Of course, they're a global institution. As a regional development bank, the ADB pledged the largest amount of any of the regional development banks at $20 billion. And so again, they were taking a look at they were using, the vast majority of that is going to be allocated to member governments, to implement counter-cyclical programs, but $2 billion of it is to work with making sure that the member countries' private sectors are kept alive and well. Turning now to the Asian Infrastructure Bank, they have a COVID crisis fund of $10 billion in 3 areas: health infrastructure, liquidity support through on-lending and credit, and immediate fiscal and budget support. And the vast majority of their financing and lending has been done in partnership with other organizations. So remember that, because that's going to be one of my recommendations. Now turning to the African Development Bank, because I understand that there's interest in Africa among your research team. So I did some follow-up research on the African Development Bank. They also have a $10 billion COVID rapid response facility. And what really struck me about the African Development Bank is that they talked about the informal sector, where 85% of the jobs in Africa are in the informal sector. And unemployment could push an additional 28 to 49 people into extreme poverty in Africa. And their policy responses are interesting too. Obviously, they want to prioritize healthcare spending for personal protective equipment and materials. That would be obvious. Targeted cash transfers and subsidies for vulnerable households. Again, that would be perhaps obvious. The central bank to inject liquidity. Again, that would be obvious. But here's the thing that really struck me is that they said civil society and think tanks, just like the Reischauer Center, should be involved to ensure that COVID interventions are carried out equitably and that governments are held accountable. And also new educational models should be developed. For us in the educational world, this is a very welcome news they're talking about. And SAIS itself, Dr. Calder was one of our deans, has just stepped down as our Dean for Faculty Affairs, was very instrumental in making sure that all of the faculty at SAIS has been trained and upgraded in the very best techniques of virtual and online learning. And this was one of the recommendations from the African Development Bank. I thought that was great. We have a recorded presentation from our faculty and senior colleague, John Lipsky, who was the acting managing director at the IMF. So I'm not going to dwell on that. But for people that are very interested, I commend you to that. That is on the SAIS Foreign Policy Institute website, where he was talking about the IMF's response in COVID-19. But essentially, their firepower, that they call it, the firepower, is $1 trillion through emergency financing, through grants for debt relief, through calls for bilateral debt relief. This is very important. Short-term liquidity line, adjusting existing lending arrangements, and capacity development for over 160 countries. And the thing that I'd really like to highlight is that so far the role of the IMF in calling for debt service suspension was very effective. And so they called on official bilateral creditors to grant debt relief to the world's poorest countries. So the IDA nations, the IDA eligible, and the G20 agreed to do that. And then also the International Institute for Finance followed up with that and called on private sector creditors to extend the same debt service suspension, which is critically important when you remember about the high levels of debt. So recommendations, maybe I could wait for those during Q&A because I don't want to take up too much more time, unless Dr. Calder, you would like me to go into a few of them now.
I think this is perfect. We'll have lots of time for Q&A. I certainly hope so. And thank you very much. You've made a tremendous number of important points. I know one that we certainly will want to come back to is the whole question of sustainable development, about how COVID-19 is, worsening the problem of development, I suppose, maybe by using environmentally unfriendly fuels of some sort, or I don't know. I certainly we'd like to hear more from you on that point as we go into our Q&A. So thank you very much for that.
You're welcome.
Now, and another issue, I might just say that what you say provokes, and also Keiichiro's remarks. Obviously, the role of Japan in relationship to this large-scale assistance program, it certainly has contributed a lot to the multilaterals, to the IFIs. Going forward, you mentioned $11.5 trillion of COVID stimulus so far. Of course, the United States has already provided over $2, and there's discussions in Congress. Who knows how far it will go, of course, but for substantially more. And the United States has an unusual ability to use its own currency, since it's a key currency, of course, and run deficits maybe that others couldn't. One question I know as we get into Q&A, who is going to help the United States, and what about the implications of this kind of stimulus and various debt packages ultimately for the international finance, for the role of the dollar and so on also. So a lot of really important issues going down the line. But maybe first, if we might go to some of our researchers. We have 3 researchers who have also been working in great detail on this whole question of assistance and the developing world and the implications of COVID-19. They are Monica Weller, who has spent extensive time in Mongolia and works on developing issues with Johns Hopkins. She's actually with us here at SAIS now. Also, Vivian Chen from Johns Hopkins, from a Reischauer fellow at SAIS, and then Corinthian Payne, who's with Howard University, and also has worked with the Woodrow Wilson Center for Scholars in their Africa program. So the 3 of those are researchers have worked in detail on this issue. They were instrumentally involved in the report that Cinnamon, I know you have seen. And to start with, Monica, I believe you have a question for Nakazawa-san, is that right?
So Nakazawa-san, thank you so much for attending this. We're so glad to have you. And for my first question, I wanted to ask, so countries around the world have undertaken a series of changes in their public health care, from requiring masks to limiting crowds and enforcing quarantines. Among these, are there specific healthcare practices that have been found most useful for mitigating the spread of disease, particularly for developing countries?
May I? Japan, to be frank, was criticized in terms of the number of PCR tests and some say inefficient governance provision of face masks or the cash stipend. However, if you look at the number of the deaths per million people, Japan is one of the best in the world. I mean, the lowest number of the deaths. I think, Japan ranks very high in terms of awareness of hygiene and health as a nature of the island nation. And hand washing, gargling, and wintertime face masks for flu prevention, I think have taken root as a natural way of life in Japan. And in fact, we help our developing countries, partner countries, to promote, to practice of hand washing in particular. For example, like in Africa, the hand washing song created through a collaboration between TB, which is the Japan Overseas Cooperation Volunteers members, and a popular local singer in Madagascar, has been sung over the years to raise awareness of the importance of hand washing. In fact, the Minister of Water, who was a staff member of JICA at the time this song was created, supported the dissemination of this, hand washing song. And that I think would be very helpful. And also, Japanese government in Japan, particularly in February, March, and April, when the first surge of COVID-19, prevailed in Japan, government requested people to avoid 3 C's to have a space. I mean the social distance. 3 C's means closed spaces with poor ventilation, to avoid closed spaces with poor ventilation. Number 2, crowded spaces open to the public. And 3, and close contact settings, putting people in range of flying droplets from speaking, coughing, and sneezing. And that, avoiding 3 C's become very popular in Japan. People, every child knows that. And that kind of, it's not a high-tech type of technology, but it can be, distributed and disseminated also in developing countries. Very basic, but very important. Thank you.
Well, thank you, Nakazawa-san. Next, for Ambassador Dornsife, Corinthians, I think you have a question. As I mentioned, Corinthians is with us at the Reischauer Center, but he's also finishing his senior year at Howard University. Corinthians.
Yes, thank you. So this is directed towards Ambassador Dornsife. So now that we've spoken about the current state of developing countries dealing with COVID-19, what steps would you recommend for large international organizations or wealthier countries in assisting lower developed countries? And what role do they play in a crisis like the COVID-19 pandemic?
Thank you, Corinthians. That's an excellent question. And as I mentioned during my remarks, the IFIs have already provided critical emergency financing to over 100 countries. I mentioned that the World Bank has allocated $160 billion. This fiscal year, the IMF has a firepower of $1 trillion to be able to bring to bear for member governments' high priority needs. The other that I haven't mentioned yet is that the Nikkei Asian Review just yesterday said that the World Health Organization says that there are 172 nations have joined in their vaccine funding program, and that participants will receive enough vaccine to inoculate at least 20% of their population. So this is very important in terms of the power of international organizations. So remember, I had mentioned that the IMF was instrumental, the IMF and the World Bank, in calling on official bilateral creditors to enter into a debt suspension initiative, which they did. So their role is coordinating with one another to make sure that their policy responses are sensible, viable, not contradictory, that makes sense to especially the recipient nation, that it is developed in dialogue with the recipient nation, that they have a convening power that is unmatched in terms of their shareholders are member governments, but they also have the power to convene the private sector, civil society, and academia and think tanks. And so that's another thing. And their role is also to convince the world of the importance of responding. And so this issue of sustainable development is an issue that I'd like to come back to. But I would say that's my answer. So coordinate, convene, convince, and provide vital financing provided with technical assistance, training, and policy advice.
Mm-hmm. Thank you. And we really do want to come back, and absolutely will come back to your question of sustainable development. Vivian Chen, I think I mentioned, she has been a Reischauer Fellow this last year, and she's now in the MA program here at SAIS Johns Hopkins. Vivian, you had a question for Nakazawa-san.
Yes, Nakazawa-san, thank you so much for your interesting remarks. While Japan's metropolitan areas like Tokyo have recently seen a rise in the number of COVID-19 infections, the total number of cases per capita remains remarkably low. One interesting fact is that Japan actually does not have a Centers for Disease Control and Prevention organization. My question is that with the ongoing pandemic, do you think that there will be the creation of a CDC-like organization in Japan to fight COVID-19? And have there been any discussions that JICA has been a part of in potentially establishing such an organization?
Thank you, Vivian, for very interesting and very timely question, I think. To be frank or honest with you, I'm not an expert of the health sector and I'm not a good person to discuss about CDC, but I would say, there are a lot of discussions in Japan. For example, like a Japan Foundation of Economic Organization, like Keidanren, which has, all big Japanese enterprises as a member of this federation, I think recommended that to the government to consider the creation or establishment of the CDC-like organization, because they also feel kind of the necessity of the control tower, which is, as far as I understand, pretty much independent from the government. I understand that the United States and China, among others, have such an organization like CDC. So probably we have to look at the lessons learned during the course of this, COVID-19 pandemic, whether that type of CDC really works in those countries, and then whether we can, translate that type of CDC type of organization into Japanese context, taking into account the various existing institutions which we have. So probably, that discussion will be, I think, going on, and we will further discuss among the experts. Thank you.
Thank you, Nakazawa-san. Next, Monica Weller, you have something for Ambassador Dornsife. Please go ahead.
Great. So for Ambassador Dornsife, many of the countries hardest hit by COVID-19 are those classified as middle-income countries, such as India or Mexico, where millions of people live just above the poverty line. So why do you think middle-income countries have been so heavily affected by the coronavirus? And what long-term impacts on global development do you think will result from this?
Thank you, Monica. That's an excellent question. And as I mentioned in my remarks, the global economy is expected to contract 5.6%, and the global debt levels as a percentage of GDP are going to be greater than at the end of World War II. So an estimated 70 to 100 million people could be pushed into extreme poverty, and then 130 million could be pushed to the brink of starvation by the end of 2020. How is this impacting middle income countries as well? My answer is that even with the fiscal stimulus of 11.5 trillion that has been mobilized by governments around the world, this is only just the start of the additional trillions that are going to be required to be brought to bear. But your question is, why middle income countries? My answer to that is that there needs to be a greater focus on governance and accountability. And remember when I was talking about the policy recommendations that were provided by the African Development Bank, at least in my research, they were the ones that jumped out to me. And I would say governance and accountability. So the role of civil society, the role of think tanks, the role of policy researchers like you is very important in terms of making sure that the COVID-19 response that has been pledged by governments and also supported by the international financial institutions is going to the intended recipients with the intended impact.
Next, Corinthians, I know you've been working intensively on Africa and COVID, and just as you also worked last year at the Wilson Center on issues relating to Africa. And I know in particular that you've been interested in Nigeria, which of course is the largest country in terms of population in Africa. I think you have a question for Nakazawa-san, do you?
Yes. So directed towards Nakazawa-san. So the medical infrastructure in Africa, specifically in Nigeria, is stated to be one of the most worst globally amongst other countries. Some of the main problems is limited testing capabilities, lack of PPE, and trained personnel. So in India, and I heard, you guys talked earlier about how you guys are the largest donor to India, and India is in a similar predicament. Do you guys think that JICA could intervene for Nigeria or South Africa like it did for India via soft loans or grants?
Yes, certainly Nigeria is, the biggest and, one of the most important country, from our point of view as well. And in fact, not against the COVID-19, but for the eradication of polio, another very difficult, infection prevailed in Africa and other parts of the world. There was one very interesting example about our concessional loan to Nigeria about the polio eradication. That is so-called loan conversion, which was adopted in partnership with the Bill and Melinda Gates Foundation. I mean, between JICA and Bill and Melinda Gates Foundation. In this, concessional loan scheme to eradicate polio, Bill and Melinda Gates Foundation had agreed to repay JICA on behalf of the Nigerian government if the Nigerian government was successful in achieving all the predetermined polio eradication goals. And in fact, the Nigerian government did it. So Nigerian government, even though they were the original borrower from the concessional loan from JICA, the fact was because of the success of the polio eradication in Africa, that was remarkable. Bill and Melinda Gates Foundation will repay our concessional loan to JICA for the next probably 30 years or so.
Wow.
In addition to that, I think for the COVID-19, I think there would be a big possibility that we will talk with the people and with the government whether Nigerian government needs both probably medical and also the economic cooperation from us. For your information, JICA is providing concessional loan. Terms and conditions of those concessional loan is purely based upon the per capita income of our recipient countries. So in the case of Nigeria, which is a lower middle income country, the normal type of our yen loans terms and condition is like a 1.2% annual interest rate with 30 years of repayment period, including 10 years grace period. But if something, for example, like some medical type of infrastructure, which you want Japanese enterprises to intervene, I think the concessional loans terms of conditions becomes more concessional. For example, like a 0.1% with 40 years repayment period, including 13 years grace period, if Japanese enterprises are very much involved in that kind of investment. Thank you.
Mm-hmm. Thank you, Nakazawa-san. Cinnamon Dornsife, as you've noticed, has spoken a lot about the importance of a sustainable development in the climate area and various others. And of course, we do want to get her sense of that. And perhaps a way into that is a question that I believe Vivian has. She's interested in the long-term implications of the pandemic for global development. Vivian, could you elaborate on what your interests are and how that relates to some of what Ambassador Dornsife has been talking about?
Sure. Thank you, Ambassador Dornsife, again, for your very insightful remarks about the developing world and COVID-19's impact. My question has to do with the long-term implications of the coronavirus pandemic on global development, such as do you foresee that there will be greater inequalities between higher and lower income countries? And also, what trends are most critical for developing countries to be aware of looking forward?
Thank you, Vivian. That's the $64,000 question. But the answer to the first part of it Will there be greater inequalities between higher and lower income countries? Absolutely. And one of the IMF's flagship publications, the Global Financial Stability Report, has noted that emerging markets and developing countries are among the most vulnerable. And another trend to really watch is the growth of inequality in developed countries around the world, not just developing countries. The greatest levels of inequality in the world are in Latin America, but we are seeing the levels of inequality between the haves and the have-nots increase around the world. This is terribly, terribly important to follow. So a trend to follow is that of inequality. Dr. Calder, in your initial remarks, you mentioned one of the important points raised in the report about remittances and the impact of remittances and countries, especially the Philippines, where I lived for 8 years. Highly depends on remittances and the dramatic downturn in remittances as a result of the global pandemic for countries and families and communities that depend on those remittances and that are part of the growth profile that makes the growth in the Philippines possible. So that's another trend to really follow. International migration. Dr. Calder, you mentioned that also as a factor in your remarks at the beginning and also in the report. So those are trends. Vivian, I would say that the report really highlights them quite well. Dr. Calder, with your permission, I could get into some of the sustainable development.
That was exactly what I was just about to ask. Please do. You said that the sustainable development is a crucial issue now amidst the pandemic. Why is that so? One would almost think that the skies are clearer, growth is, there's not as much commuting and so on. So perhaps the global environment is better off, ironically enough, amidst the pandemic.
No one would dispute that the air is cleaner. No one would dispute that. I think we just need to take a look, those of us that live in cities, to take a look at the quality of air around us and the blossoming of wildlife. It may just be we have more time on our hands to kind of notice, the wildlife around us, but still, yes, that's a good point. The World Economic Forum report and the World Resources Institute, where my husband works, have done extensive research on climate change. That is not my area of expertise, but climate researchers indicate that even with the cutbacks in global travel that has resulted from this global pandemic, that is not enough to make a difference to prevent the 1.5 degrees Celsius change that is agreed by the environmental community and scientists to be the floor that we need to aim for. So I don't mean to be the spreader of bad news, but that is, I just have read that and commend that report to you. I'd be very happy to provide a reference for people who want that. But this World Economic Forum report on the future of nature and business, their central proposition is that the right investments in nature are going to create a stronger economic future and reduce the risk of permanent economic scarring. That caught my eye. And they're promoting a stimulus program. This is that, 11.5 trillion in stimulus relief and the trillions additional that are needed. They want to build back better. So they want to protect and restore nature, drive resource productivity, scale up new regenerative value change that could result in laying the foundation for creating up to 395 million new jobs over the next decade, restore the stock of natural capital, the foundation for a sustainable and resilient economy, benefit human health through improved nutritional security, reduced air and water pollution, and that's your point, Dr. Calder, and extreme weather events from climate change. Because once the economies pick up and air travel begins again, and the economy depends on not renewable energy sources, that they are stuck in a very difficult place of making the tough decisions about how to power their economies. there could be also a reduced risk of the zoonotic disease spillover, that was attributed by many scientists to the cause of this COVID-19 pandemic, and indeed many prior outbreaks like the Ebola crisis.
Mm-hmm.
So I would say that's the report that I really commend to everyone. And it really struck me the importance and the credibility of their recommendations.
I see. So then fundamentally, the linkage as you see it is that this pandemic gives us a chance to think about the post-pandemic world, that the challenges, the dangers of global warming and so on haven't disappeared, even though we may not be looking at them right now. We better be thinking about the next step beyond this. Is that right?
Really must. Thank you. Perfect. Oh, excellent summary. Thank you.
Mm-hmm. Well, we already see, I see that we've got some very interesting questions coming in, and I know that we also have some more questions from our researchers, but perhaps we should turn to a few of the questions that have been coming in from outside, and along the way, hopefully, we can get to more of our researchers' questions also. Several of these, of course, relate to Japan, and perhaps to move briefly back to Nakazawa-san. The first question actually that came in was something about the Japanese model and the developing world, model of response to that of China in this COVID-19 pandemic crisis. And this particular person wondered how you would characterize Japan's likely response to the developing world going forward, and whether it might be an alternative to China's response, how you would characterize it comparative to China.
If I talk about the, international cooperation, to partner developing countries, from China or from Japan or from other, countries. I understand, for example, like China provided, masks, PPEs, and other medical supplies and medicines to all over the, let's say, 150 countries. In addition to their sending of medical team to 20-some countries. That was fantastic also. However, the capacity development, which JICA and Japan have put high importance upon, is very much important for the sustainable, healthcare in developing partner countries. Without such, kind of sustainable type of capacity development of, capacity development for the people and the enhancement of the organization or institutions are critical for those, partner countries to, combat with the future challenges. COVID-19 may be over in a few years or maybe less, I hope. But another, pandemic or, some infectious disease may come. But in order to prepare for that, basic ability or the capacity needs to be enhanced. That, what, Japan is putting importance upon. Is that enough for as answer?
Yes, well, thank you very much. We have actually a related question from an Australian diplomat with the Awaji Youth Forum in Japan, of all places, Elizabeth Masamune. And her question relates to education. And I think this is something which is quite interesting from both of you. I'd like to perhaps briefly, if you could just talk about the Japanese view of this, but I'm sure that Ambassador Dornsife as well would have some views. The question is how to go about, and whether this is important to do, educating disadvantaged people in the developing world on basic health requirements. Do they understand the dangers involved with COVID and how to go about doing that, and how effective is that likely to be? Of course, they have a difficult situation. Often they're in the service industries and difficult circumstances. Does educating them, is that an important priority? And if so, how to go about it? I wondered if you might have some thoughts on what Japan does or how Japan sees that.
Thank you. A very interesting and important question, I think. Let me give you some examples. I have already mentioned the washing hands songs, which are now in Madagascar. But that type of very basic and easy type of practice is quite important. In Pakistan, we have informal education, program in which many girls who cannot go to formal schools are the members of the trainees, and to teach mathematics, to teach languages, and also to teach very important health practices, including like washing hands and gargling, or face masks in the time of flu, the season of the flu, for example. And also in Myanmar, we have helped Myanmar Education Ministry to work out the new elementary school textbooks, which of course includes math or physics, physics, languages, and etc. But again, some type of social practices, which is good for hygiene and healthcare, is always incorporated. So that type of thing would be helping not only the normal type of student, but also some disadvantaged type of children and vulnerable part of the society. Thanks.
Thank you. The question, actually, Cinnamon, as the next question we'd like to ask you, relates both to this issue of education that has just been raised, but also a question that just came in about your earlier remarks. You mentioned that increased reliance on renewables and sustainable development helps to reduce zoonotic diseases. And this particular questioner wondered where that, what sort of substantiation you have there, and if you could say a little bit more about the report that you said that was based on.
Absolutely. So Nakazawa-san, thank you for all the detailed examples from JICA. Let me remind the audience and others that the shareholders of the international financial institutions are governments. And so the assistance that is provided from the international financial institutions goes directly to governments. And so therefore, the assistance that would be provided to impoverished people or people at the base of the pyramid, it's absolutely critical. The hand washing song in Madagascar, that's a great example, but it would be through ministries of health and supporting their programs of outreach. Again, I'd go back to the role of civil society and holding governments and international financial institutions accountable to make sure that that assistance that is provided to ministries of health is reaching the intended people, and especially to work from the very bottom up to prevent spread of disease. I mean, if we just look around at our own environment, the mask wearing, the hand washing, the social distancing, all of these practices are very important to get the COVID pandemic under control and indeed to stop the spread of the virus, or to prevent a second wave that many of us are fearing in the fall and winter of this coming season. And so that's the question there. The report that I mentioned is the World Economic Forum and the Future of Nature and Business, And what I will do is I will provide this to the Reischauer Center, and it be perhaps shared with people.
Yes.
It's publicly available, and I very much commend it to you. And the zoonotic diseases is a point that is made in quite the preventing the possibility of zoonotic disease transfer is a point that's made in that report as well as in others. You're welcome.
Thank you very much, Cinnamon.
Sure.
We have another very interesting question back to Japan once again on JICA's approach to COVID. And traditionally, of course, Japan has been concerned about poverty alleviation and infrastructure, this questioner says. And he or she is wondering, is there something new? Is there a new departure in Japan's response to COVID, or is it more or less continuous with its traditional aid policies?
Interesting questions. I think that both. Traditional way of helping, as I mentioned, like a capacity development of people, institutions, and organizations for the health sector is very much the core of our approach, because at the end of the day, capacity is the most important part of our development cooperation. And JICA is putting high importance upon human security and quality growth. And last year we revisited the concept of human security, taking into account the kind of new challenges or new risks or new threats which we have to take care in the kind of version 2 of the human security, which probably need to include this COVID-19 type of pandemic in the globalized and connected world. So even though our approach might not be that different, but for example, like a budget support type of assistance, which we have been providing now, in cooperation with Asian Development Bank, as Cinnamon mentioned, or the World Bank, or other multilateral institutions. There, we put some kind of policy actions need to be taken by the recipient government side for the developing their healthcare system kind of building back better.
I recall that from previous discussions that one of our researchers, Vivian Chen, has a question that I think relates right in here about sort of new angles, whether there's something new in JICA's policies toward COVID-19. Vivian, I'm sorry to put you on the spot like this, but I just remember that you had that question.
That's right. I recently read an article by JICA President Kitaoka Shinichi-san, and he was talking about introducing or implementing more Japanese-style hospitals, particularly in the developing world like Africa. I was hoping, Nakazawa-san, if you could elaborate particularly how JICA could contribute to developing countries through helping improve or construct hospitals in those areas.
Great. Yeah, it is true that, our President, Mr. Kitaoka, recently launched a kind of global initiative to promote health and medical medicines. And as I mentioned in my original remarks, we have many, examples like in hospital, preventing in hospital, infections in like Vietnam, and also in, Ghana, the capacity of PCR tests have been expanded over the years, and they will provide some assistance to their neighboring countries. That type of assisting South-South cooperation, and which we call triangular type of cooperation, among which JICA is one part, I think would be very important. For your information, under this Kitaoka-san, our president's new initiative to promote health and medicine, there are, four pillars as I have already mentioned. Infectious disease research, diagnosis, and early warning system. Early warning system would be, very important for, developing partner countries. And, we are learning, for example, like from the Indian experience. As I mentioned, they acted very swiftly, and lockdown was, very early in the stage. But that made a little bit, economic part difficult. And how we can, balance between the, economy and health would be very important learning. I think we should draw some lessons from this, pandemic. And the second pillar, as I mentioned in our present initiative, is infectious disease treatment and case management systems. And the third, infectious disease prevention and mainstreaming of health security across all sectors. What it means is not only health sector or the Ministry of Health, should be the counterpart of these type of activities. As we have already talked about, Ministry of Education, for example, would be very important. And if we talk about the related infrastructure such as water supply or even the roads, in order to improve access to the hospitals from the rural area, such type of infrastructure are also very important. So mainstreaming among all sectors, mainstreaming health security across all sectors are very important. And finally, as Japan has already and always put us upon universal health coverage. Since many Asian countries are now very much growing, even though the COVID-19 put pressure on the government spending, at the time of economy is growing, it is very much necessary for the government and for the people to prepare some kind of social safety net and social securities, pension fund, health insurance, that type of thing. We are also supporting.
Mm-hmm. We hate to overwhelm you, Nakazawa-san, and we'll go into to cinnamon in just a moment, but there was one other question that just came in. It's sort of a high-tech versus low-tech question in terms of dealing with, assistance to the developing countries. And Corinthians, I think you have one about the relevance of high-tech solutions.
Yes, so my question to Ambassador Nakazawa-san, so what high-tech solutions will provide the best resources to countries grappling with COVID-19? Specifically, focusing on testing, Nigeria, South Africa, again. So, yeah.
May I respond?
Yes, all right. Let me just add to that. High tech, exactly the kind of thing Corinthians was talking about, high-speed testing or whatever, or low tech, for example, masks, social distancing, some of the stuff that Japan pursues quite a bit.
Yeah, in fact, the importance of the low tech is, that would kind of increasing the awareness of the people, which is critical. But I would say, Taiwan, for example, and South Korea, introduced technology-driven public health response, very rapidly. Taiwan National Health Insurance Administration, I think, offered online data with real-time updates on face mask availability in all, contracted pharmacies and selected local health centers. And based on that, open data, numerous software applications quickly emerged to assist the public in finding, sales locations efficiently. And Korea also did a, fantastic job in, PCR testing. And I think, Korea's success also relies on people's, tolerance for culturally and legally of, personal data sharing. And smartphone, I think, helps a lot. So in Nigeria, or other African, sub-Saharan African nations, smartphone changes their lives a lot. Farmers can send or, be informed about the market necessity or market price of their products. And that type of thing changes a lot, and also in cash transfer and so on. And I think that's smartphone could be utilized by the people and by the government, to combat against this COVID-19 as well. Thank you.
Well, we're getting close to the end of our time, but we have several extremely interesting questions. Perhaps I can indicate what those are and perhaps summarize. Then our two participants could respond, because they really made me think a lot. First of all, we had a couple of questions on American policy. And I hope that Ambassador Dornsife, certainly, in that she's been involved in important ways in that. And of course, Nakazawa-san has seen from the outside, in a critical sense, maybe, how American policy has evolved. But one question has to do with the US exit from the WHO. What kind of an effect might that have on health assistance by various nations? And of course, that could include, and it would be interesting to hear from Nakazawa-san on whether that has any effect on how Japan approaches health issues. That would be putting him on the spot. So that's one question that I just want to throw out there. And first of all, have Cinnamon respond to. The other one relating to the US role. The role of the United States in helping poor and middle income nations. The US itself has been so tied up in the midst of this pandemic. Has it really had the psychological or the financial or the operational distance to be able to play significant roles in any ways? Maybe the answer is exactly what you said about, or the appropriate answer, the US role in the international financial institutions to be able to act there. But I'd be very interested in your responses. A third question, I wish time would present it, and I have to say that this comes from Monica Weller, which was a very thoughtful question. Do you see the potential for unified international action in addressing the long-term developmental impacts of COVID-19? Or do you think responses will continue on an individual country level? My apologies, Monica, that because of time. And then one last question for our concluding remarks. I wonder if our presenters could ponder. This came from our good friend Aiko Doden, who many of you know, one of NHK, the Japanese National Broadcasting's most distinguished commentators. And she said, if this pandemic is a wake-up call, what is it a wake-up call to? Which I think is a very interesting way to end this. So thank you, everyone who contributed. Thank our presenters, and but we would like to hear from you. How do you see the role of the United States, and then what is this? Can the world cooperate, and what is this a wake-up call to?
Okay, well, maybe I should start.
Yeah.
And the question about the WHO, this is a highly disappointing decision on the part of our administration, the current administration, to withdraw from the WHO. This is bad news for the WHO, and of course, other countries would be perhaps expected to take up the slack. In the research that I've done on that topic, the WHO has been called upon to take grants from philanthropic foundations to be able to just step up their assistance. And when one large country shareholder and contributor and member of the organization falls behind on its commitments to the organization, this happened when I was at the Asian Development Bank, when the US was in arrears to its commitments to the Asian Development Bank, other countries would use that as cover to not step up and provide their assistance. So this is bad news for the WHO. The reference that I made earlier to the vaccine fund, that seems to me to be an initiative, the part of the WHO to really step up and exercise its global leadership role. There's an article in Forbes magazine, again, I will provide this. It's called US Withdrawal from WHO is Sad for Global Health and Bad for America. And that's by Madhukar Pai from June 3rd of this year. I will send that reference to you. And I just commend that to you because you get into a question about how can the United States withdraw from the WHO? It's very complicated. We don't have time to get into it, but that article, in my opinion, does a pretty good job of getting into it. What is US assistance to developing countries and the poorest countries of the world? I remember during the Asian financial crisis when I was on the Asian Development Bank board, one of the responses that I gave was, of course, bilateral assistance through the US Agency for International Development is the bilateral flagship program of the US government. But through its very large membership positions, Dr. Calder, you anticipated that I was going to say this, that this shows the US commitment in a multilateral system. And what's very beautiful about this commitment in a multilateral system is that US policy views take on greater amplification, and indeed any government that drives policy at an international financial institution, their bilateral views are amplified in a multilateral setting. So I would say that the US ongoing commitment to the multilateral development banks, to the IMF itself, is a clear demonstration of the US ongoing support. There's also the Millennium Challenge Corporation that provides assistance to developing countries and emerging markets against a very, very different formula, but it is also a tool in the arsenal of the US government to provide development assistance. Monica's questions about, do I see unified international action in addressing the long-term developments of COVID-19, or do I think that responses are going to be continued at an individual country level? Monica, the tracking of the disease and the response has to be on a country level. That is how data is generated, and that's how it's tracked. Indeed, Johns Hopkins University, which is tracking the incidence of the coronavirus cases around the world and deaths from the disease, does it on an individual country level. And kind of that's an easy organizing principle for people to understand. However, as this is a pandemic and it doesn't understand borders, of course the response is going to have to be global. And that's where international financial institutions, global organizations like the WHO, the United Nations, and others will have a very critical role to play. So the answer is the data will be tracked on an individual country basis. Countries are responsible for responding to the needs within their borders, but they themselves have to take up regional responses. Nakazawa-san, you referred to your participation several years ago at a Reischauer Center event and the role of regional organizations and how important this is. Earlier in my career with the Asia Foundation, I was the director of regional programs, and so I tracked very closely ASEAN and APEC and other regional organizations in the Asia Pacific arena, and those organizations have a critical role to play. And a wake-up call to what? So I'm going to answer it in the same way that I was sort of dangling this. I would say it's a wake-up call to, we are all so interconnected, and we cannot forget about the global issues that are being brought upon our world by global climate change. And so it's a wake-up call to the importance of collaborating on the health and the economic responses to this, but let's not forget climate change and the importance of responding by building back better to that very, very pressing global problem.
Yes, thank you very much. Very briefly, Nakazawa-san, apologies that we don't have a lot of time. But,
comment. It is a wake-up call for the world and to the people. We should unite. In the globalized world, as far as vulnerable part of the societies or nations remain, everyone is at risk. That is similar to the, after 9/11, Bush administration insisted, unless vulnerable part of the, nations need to be, developed and improved. There can be a kind of warm bed for the terrorism. That is same as a pandemic. So this is a wake-up call to unite.
well, thank you very much. This is no doubt a historic moment. 1946, 1918. This may well be one of those world historic moments when the world does need to be thinking about where it's headed. I hope that you all have found this useful. We certainly want to thank, of course, first our two speakers, also the researchers who have worked about and thought about this report, and also our audience. And this is the beginning of the dialogue, no doubt, that we will be continuing over the years. And we look forward to doing that and look forward to talking again. Thank you all very much for participating. Good evening and good morning, wherever you are in the world.
Great. And thank you to
Yeah,
Dr. Calder.
thank you. Thank you very much, Cinnamon. We appreciate it, and Nakazawa-san, and our researchers too, and our audience. Thanks again.
Have a nice day.
Thank you, everyone. Yeah.
Bye.
All right. Good evening, good morning, good afternoon.